Hello, and welcome to another episode of LSVT Global's podcast, Think Big and Loud, where we share inspiring stories, expert insights, and engaging conversations, all designed to empower and uplift the lives of individuals with neurological conditions and those who love and support them. My name is Beth Peterson, and I will be your host for the show. Today, we're joined by Erica Vitek, an occupational therapist and leading expert in Parkinson's rehabilitation and pelvic health. Erica combines her experience from LSVT Global and the Herman and Wallace Pelvic Rehabilitation Institute to bridge two often overlooked worlds, that neurologic care and pelvic floor therapy. So through her work in this niche specialty, she helps patients, families, and rehab professionals talk openly about pelvic health and use practical strategies that protect dignity, confidence, and everyday independence. So, Erica, thank you for joining us. I look forward to talking all things pelvic health with you.
Thank you for having me, Beth. I'm looking forward to it as well.
Well, great. And I wanted to get started. If you can just kind of take us through your journey as an occupational therapist. So, what sparked your passion for Parkinson's rehab and pelvic health? And how did those two worlds eventually intersect in your practice?
So I was a college student at Concordia University, Wisconsin, and I was going through my graduate program, and an occupational therapist came to one of our courses and was like, "This is what pelvic health is," talking about all the different things that you could do for a patient's quality of life to make such a difference, because these are big challenges. And it just really caught my heart, my attention, my interest really was sparked by that talk. And from there, I really wanted to leave college and do that kind of work, but really realized that it takes significant training to get into that field. And also the job market was a little tight when I graduated from OT school way back when. And so really my first opportunity to get a job was where I actually work right now. I've been here almost 25 years. And I'm at Aurora Sinai Medical Center in Aurora Healthcare, large hospital system in Milwaukee, Wisconsin. And this was, again, like I said, my first job. And we were a Parkinson's specialty hospital. And I was like, wow, I don't know much about Parkinson's, but they needed someone to do that type of work. And so in the back of my mind, I was always thinking, gosh, pelvic health is really my area. That's what I'd like to do, but I needed to work. So I got on board here. And I worked in acute care, and that was actually a huge blessing in disguise, honestly. Acute care taught me so much about patients that were ill. I learned so much about understanding, their hospitalization. And really what was key in that was that we hospitalized a lot of people with Parkinson's at that time. It was kind of an interesting approach that our neurologists had here. We had 2 movement disorder specialists at that time, and they did medication holidays, which really aren't done anymore, the whole hospitalization kind of thing. But really my acute care caseload was all people with Parkinson's. And I had to learn really quickly what to do in an acute care setting with people with Parkinson's who didn't have their carbidopa-levodopa on board, and they couldn't move. And there was a lot of things going on as they were getting those medication adjustments, and then they would go through their acute rehab and inpatient rehab and such. And in that process, I was really, really intrigued in the growth of Parkinson's rehab as an outpatient therapist at that time. So LSVT Big came on the radar, and I was like, oh my gosh, I want to take this course and learn more. And I took that in 2009, and I was like, I need to be an outpatient therapist. This is really what I want to do. In the meantime, I was also still dabbling in the pelvic health type education and was getting some certifications. And I had some physicians here that were like, let's start you on some outpatient. So I was dabbling in outpatient already that way. And so it was a nice transition when I learned LSVT Big and I was trained and certified. It was really great because I was already having this caseload developing with a little bit of pelvic health, and now I could incorporate LSVT Big. So it really helped me transition full-time to outpatient, which I did around that time as well. And then as I was getting even more experience, LSVT Global approached me about being an instructor. And I was like, my goodness, I've never taught anything before, but I'm really excited about it because I loved the changes I was making in my patients. And that kind of came about. And then as I was learning how to teach and traveling all over the country, I would come across articles about pelvic health because I was loving pelvic health as well. I was kind of doing these two niche specialties.
Yeah.
And they would be about Parkinson's and pelvic health. And I would be reading about the bladder and Parkinson's and the bowel and Parkinson's. And then it would come up like when we were traveling with my other faculty members, I would be like, so did you know this about the bladder and Parkinson's? Did you know this about the bowels? And everybody would just like kind of tease me a little like, oh, there's Erica talking about the pelvis again. Here, we're going to dinner. We're talking about the pelvis. And I'd be talking about the pelvis all the time. And so then one of my colleagues at LSVT Global was like, why don't you write a course? And I was like, oh my gosh, write a course. I'm like, write a course. I was like, no, I don't know if I can do that. And then that really resonated in me. And I realized, I was like, gosh, I think maybe I do have something to offer here. I was treating these two things separately, but knew that there was this connection. And the literature was really scarce at that time, Beth. Honestly, there really wasn't like a heck of a lot out there on pelvic health and Parkinson's because really the attention is paid to the motor symptoms, not so much on motor symptoms. And so it was like just such a intriguing thing. And then I wrote a course so I could teach other therapists how to treat people with Parkinson's and their pelvic health conditions.
So now I know you have 2 courses now. So this course, when did you do that course and what's the name of that one?
Yeah, so that's with the Herman and Wallace Rehabilitation Institute, and that's a 2-day course, about 10 hours of material that covers very, very in-depth, not for the maybe beginner pelvic health person, but as you're kind of getting more education, taking specialty courses to just get some advanced education. So that's through Herman and Wallace Pelvic Rehabilitation Institute. I wrote it and instructed, and then a brand new course with LSVT Global that we're super excited about, just launched this year in 2026, about the foundations and kind of more of a basic layout of just an introductory information about pelvic health and Parkinson's and kind of why is this important and how does this present in someone with Parkinson's, and then some just information to kind of get the mind thinking about all the different aspects and the different things that even patients can do right now to start helping themselves. So this course that I have with LSVT Global, which we'll talk more about, can be for all different individuals to take: therapists, patients, professionals. So,
okay. Perfect. Okay. Well, thank you. That's a great introduction. And it's neat to hear. I didn't know the story of how your worlds came together. So it's great to hear that background. And I'd love to hear, 1 or 2 stories of people with Parkinson's whose quality of life transformed through pelvic health education and treatment. And maybe as you get into that, for our audience, if you can do just a brief introduction on really what pelvic health encompasses, and then maybe how those stories kind of weave into what you do as a pelvic health specialist.
Absolutely. Yeah. So pelvic health is really looking at the whole person in regards to how they present to you, but then really focusing in or honing in on their bladder function, their bowel function, and their sexual health function. And so really taking a really complex history of where they've been, what else they have going on, and then leading into, their symptoms of their bladder, bowel, and sexual health. So thinking about bladder, like, is there any incontinence? Is there urgency and frequency? Is there difficulty with getting up at night to go to the bathroom, those kind of things? Or the bowel, like constipation or fecal incontinence. And then sexual health can sometimes be pain related, like pelvic pain, dryness, changes with aging, things like that. So all of those things are really encompassed in the evaluation, and then we follow that up with treatment. And Beth, I've had so many patients that absolutely have, there's such an abundance. But I do have 2 stories that, I would love to just be able to share with the audience. And one of them being this gal that I treated, who she has had Parkinson's for a number of years. She got a bladder infection, and about 6 months after she was then treated for 2 bladder infections, so it recurred, she actually was having urinary incontinence that she never had before. And so it wasn't like the Parkinson's necessarily caused this, but the Parkinson's was in the background, and she was having struggles with her bladder. And so she came to me and she said, gosh, I think my last resort is I'm going to have to wear a bag the rest of my life. And I was
Mm.
like, oh my gosh, no, we can work on this. We can work on this. So I think there's a lot of fear when the body isn't working correctly, and it's very embarrassing and anxiety provoking when you can't make it to the bathroom. And so
Mm-hmm.
some people are feeling like it's like an extreme measure, like this might be, gosh, this is it for me. I'm not going to be able to manage this bladder problem. And really what she had told me also was she went and did some of these niche or marketed treatments. She did this magnetic chair treatment that cost thousands of dollars, and it didn't help. So she really thought, like, I'm at the end of my rope. I've tried Kegels, which is like pelvic floor exercise. I've tried all of that. Can you please help me? There's got to be something else. I don't want to beg. And so what ended up, we discovered in our talk together is Parkinson's, yes, was affecting her muscle capabilities, her ability to react quickly with her pelvic floor. So we know that Parkinson's comes with slowness of movement, and just like reaction time can be really challenging, or even some strength or activation of a muscle with the right amplitude. So that I've found is kind of a key, is getting that muscle activated with the right amplitude that we think about in our physical rehab type setting. But that was just one piece. And she had also had a total hysterectomy years and years ago. And we realized it actually was somewhat related to hormones and estrogen depletion. So it's like you have to really look, sometimes dig a little bit. And she got some estrogen cream, and that really helped support her pelvic musculature and pelvic tissues, which then helped us do better with the exercises. And we were able to work on even some old scars from a C-section she had that seemed to like be pulling on her bladder. And so there was just a lot to it. Additionally, one thing that's really important that we also found is that with some people with Parkinson's, they actually don't fully empty their bladder. And so they might have urinary incontinence, not because they just can't hold it, but maybe their bladder isn't emptying. And she did have a little bit of residual in her bladder, which with some training of the muscles also helped her empty better. So it's very complex and lots of layers, but really just amazing hope can be provided in some of these things. She said she started applying the estrogen cream, and it was like a switch. The estrogen cream was like a switch, and then it helped all the rehab following.
Yeah.
She's a great example of just how amazing just digging a little bit deeper and the expertise can really help somebody like that. Additionally, my other story is about a gentleman who came with his wife. He actually wasn't diagnosed with Parkinson's yet. They were on a waiting list for a movement disorder specialist for a second opinion. And so they saw me at Wisconsin Parkinson's Symposium. So we have a Wisconsin Parkinson's disease group here, association here, that's very active in our community. And so I do a lot of speaking for them at support groups and then the symposium. And she brought him in and said, you did a great talk. I really want to help my husband because I want to keep him at home longer. He's having so much trouble. He was having some cognitive issues, movement issues, things like that. And his wife was slowly turning into more of that caregiver role, which is another thing that I help patients deal with too, and that sexual health role too, and changing roles as well. But really, what was interesting about this gentleman was he had no idea how to squeeze and relax his pelvic floor. He could not, the muscle just wasn't working correctly. And when he finally got to the movement disorder specialist, he went on carbidopa levodopa. And it was like the levodopa switch. The other gal had the estrogen switch. This gentleman had like the on-off switch. He all of a sudden used his muscle. He was able to contract and hold back urges. It was life-changing. The other thing too, he was getting up a lot at night to go to the bathroom, and it was keeping his wife up too. So there's like huge quality of life issues for both the patient and the spouse. And so we were able to do a lot of different strategies for that too. And it really made a huge difference in their quality of life. They could do more things together. They could take longer car rides together, and he could stay at home with her. So just provides so much benefit with sometimes little behavioral changes. And sometimes it's just more of a muscular coordination thing, and we can pull it all together. So.
Oh, that's great. Yeah. I feel like you changed the direction of their lives just by improving, things that you had to dig a little for, but it's worth it because it can, completely change the quality of life for them and those around them. So thank you. I feel like they're lucky to find you and other specialists in this area because it can make such a big difference. So thank you for sharing those.
Absolutely.
And I did want to touch on your course. So that new course, Foundations of Pelvic Rehabilitation for Parkinson's. So can you give the listeners some key takeaways from the course?
Yeah, absolutely. So I really wanted to introduce this course in a shorter version of kind of more of the
Mm-hmm.
complex version that I have, because I really do feel that even individuals that aren't treating pelvic health can play just a huge role. And
Mm-hmm.
a lot of times the non-motor symptoms are somewhat overlooked by the motor symptoms because those are a little bit more obvious. They're a little bit more of the time that the neurologist takes to address like the motor aspect, someone's functional ability. But I think the non-motor symptoms are generally becoming just so much more of a highlight of something to pay attention to. And I feel like this course really does pull that into view even more to bring that to light. Additionally, I think that some challenges in the healthcare field is even talking about these things and having that sensitive conversation with patients. And I do find that it can be really helpful for patients just to feel like it's normal for us as healthcare professionals to say, you know, this is a normal thing to potentially have some challenges with this, like saying, you know, did you know that Parkinson's can affect your bladder? Did you know that Parkinson's can sometimes cause constipation? Some of those kind of things, just to even be aware that Parkinson's could be the root of the cause, and that there is actually something that we can do about it, and just to try to feel more comfortable talking about it. And I think sometimes not knowing where you might send that person can be challenging, right? And you may not bring it up, right? So you may not want to bring up that conversation because, well, what do I actually do about that for the person? So I'm hoping that it can provide some benefit for that, as well as just to know, well, then what would I have the patient do or try in that regard? Also, there's just a lot of myths out there that people have to live with this, right? They have to live with these bladder problems. There's nothing we can do about it. You're just getting old, or only medications can treat this. But really, in reality, exercise and different techniques, behavioral modifications and lifestyle changes, routine changes, sometimes simple things can make huge differences. And so I think even just this overview of some of those types of things, which we have some great handouts in the course for that really address that, to like kind of like give a little kickstart to some simple things. Can really give someone's practice who doesn't treat pelvic health some options and some education to give to their patients, which can be really good. And then another thing just to offer with the course was really defining what this might look like in someone with Parkinson's and how that might be different for someone without Parkinson's. So defining what normal might look like, and then what someone with Parkinson's might experience that might be a little bit different. And some of those key things to pay attention to, like, for example, people with Parkinson's tend to have more of the overactive, gotta go kind of bladder. And they might experience more constipation than the average person. And they might have other related sexual health concerns that maybe the average person might not experience. And so it could be really helpful just to even know what those things are and what to ask for, to look for.
Yeah, I think that's great. So I took your course, and as a speech language pathologist, I found it very helpful to just, like you're saying, giving them space to talk about it, to normalize it, to know that it happens, and also hopefully to guide them on what to do. And I liked you said something about, don't wait for them to bring it up, because they might not. So you can be, kind of that safe space to talk about it and help them through it. So I really love that idea that professionals working with those with Parkinson's, even if it's not your specialty area, can offer that, again, kind of that safe place to discuss it and normalize it, and then help know where to go. So I appreciated that information that you shared. And then can you give some examples of how pelvic floor therapy fits into evidence-based care for people with Parkinson's?
Yeah. So with the evidence that's out there, there's always more research going on. But I would say, one of the first things is that the evidence does tell us that people with Parkinson's do experience bladder, bowel, and sexual health concerns more than just the general population. And so I think that's important to recognize that those individuals may be more challenged in this area, and that we want to make sure we ask about it. And that if it's hard to ask about it, maybe we give them a questionnaire, or maybe it's included in our clinic questionnaire, or other ideas like that. Additionally, falls. We're always worrying about falls with people with Parkinson's, with advancing disease. And so urinary incontinence and nighttime, so nocturia, so frequent nighttime voiding, can be really some high risk factors for falls. And so being able to have some conservative management strategies to try to defeat those things so that we don't have this rushing to the bathroom or getting up trying to walk at night maybe as much, that can help really just kind of bring that risk factor down for the potential of injury or falling. Additionally, one other thing to consider is the medications that are used to treat some of these problems in the pelvis or for pelvic health do cause a lot of side effects. And so people with Parkinson's already have this huge, medication load potentially or schedule that they have to follow. And to add more pharmaceuticals onto that really can challenge them. So I think it's also just good to know that there's some conservative options for individuals that would prefer not to do the medication route.
Mm-hmm. Yeah, no, that's good to think about. And you touched on this a little, but I just wanted to ask how the course and the information in your course empowers therapy professionals, so PTs, OTs, SLPs. How can they spot dysfunctions early and make those referrals, and then overall, improving that dignity and quality of life for people with Parkinson's?
Yeah. So with the course, it really goes into what to even look for with knowing what normal might look like, right? There's not really a normal or perfect normal, but what the average person might experience or what you might expect when the bladder's functioning pretty well and doing well, or the bladder's functioning, or the bowel, is functioning pretty well. So when you kind of know what baseline should look like how much should the average person go to the bathroom, for example, as far as time. So for example, when someone tells me they go for 3 seconds of urination and then they're back in there in the next hour and they only go for about the count of 3 seconds again. Really, the average person should, for example, go about 8 to 12 seconds when they go to the bathroom. Okay. So things like that, little tips like that, where just knowing what might be the average person's volume coming out would help us to really recognize, yeah, that doesn't seem quite right. Then you're so urgent, but you hardly go, and things like that. So just recognizing little small things like that might indicate a specialty referral. And then actually reaching out to the movement disorder specialist, right? So when you know and recognize what some of those things are, say in your session of LSVT loud or LSVT big, and you're treating someone with that technique, but they have to leave for the bathroom often, or they're tired because they were up all night going to the bathroom, or maybe they have some bloating and their stomach hurts, or they report to you that they're having some constipation issues. Maybe that might just indicate to that provider then, well, let's talk to your movement disorder specialist about that. Maybe we should get a referral, because even urogynecology, urology, or a GI specialist could also take a look at the person's symptoms and maybe give them a little boost as well, as far as further assessment, further testing, or maybe even then refer to that right specialist if you don't have someone in your area or someone that you refer to for pelvic health therapy. But we can do more of a medical referral initially and then kind of lead into pelvic health rehab.
That's great. I love that idea. Knowing baseline or average can really help recognize if something does seem off. So that's great. Well, and then I know the course is open to anyone, so people with Parkinson's, their loved ones. So what value does it bring to those who aren't therapy professionals?
Yeah, so we have these 3 great handouts of lifestyle change. So we have the bladder lifestyle change, the bowel lifestyle change, and the sexual health lifestyle change. So these are simple changes, like top 10 tip lists that really can give you some self-management strategies, things that you can take on to really, really give it a little bit of a starting point, right? So the simple changes, the simple behavioral changes, like for example, not drinking caffeine because that can make your bladder aggravated, or certain times to sit on the toilet with facilitating a bowel movement, like 15 to 30 minutes after a meal. So simple tips like that, top 10 tip lists to just try to help with that self-empowerment, really kind of take it on and let's see if we can make a change by doing some simple things. But if that doesn't work, then we have resources in the course that help those families, people with Parkinson's, to really then find that next step. Like what would that next step be if we've tried the easy things and that really didn't do it for me?
Mm-hmm. Got it. Yeah, those sound great. Well, thank you.
Yeah.
And for those, healthcare professionals that don't specialize in pelvic health or Parkinson's patients or their families, what's one actionable step related to pelvic health that they can start today?
Yeah, so I was thinking about that and what would be one simple thing. And what I found that really, really helps with that initial like awareness is maybe doing like a symptom diary. So doctors talk about doing like a symptom diary for motor symptoms, right? Well, when does your tremor come on? When might you have dyskinesias? When might be your off times? How does your blood pressure look throughout the day? Things like that, depending on their symptoms. And really with pelvic health, I do a lot of this, but this could be something very easy to do at home too. There's a lot of different apps related to diaries for bladder or bowel symptoms, or even just keeping your own just track on a blank piece of paper. Like, how many times did you go that day?
Mm-hmm.
How much did you go? Can count in seconds as kind of an initial. Sometimes I do more accuracy with actual measuring, but counting in seconds can be a good one. What did you drink that day? And kind of laying it out and seeing, okay, how does it all relate together? And really, actually, a symptom diary with the bladder or even the bowel, I was focusing more on the bladder there, can really just bring so much awareness to what's really happening, right?
Mm-hmm.
When was the leakage happening? Was it mostly happening, after I drank 2 cups of coffee? Or was it happening more just later in the afternoon when really it doesn't seem to relate to something?
Mm-hmm.
Or maybe you had a soda, or you had, there were some things that were related. And so it can kind of be nice to lay that out. And even if you can't yourself make the match to what that might be, it can be really helpful for the healthcare provider that does know a lot about pelvic health to be able to see that. Additionally, like looking at the bowels specifically for symptom diaries would be like tracking how much fiber you eat, how much water you're drinking, how often you have a bowel movement. And then there's ways to, which we talk about in the course, ways to rate like the type of bowel movement, which can also tell a lot about the person's health and the person's hydration or fiber intake, with formation of the bowel, because we want it to be a particular consistency, size, or amount to ensure that we're not getting that constipation.
Mm-hmm. That's great. So I like that tracking, looking for patterns, and then trying to tweak. And I like your method, a more conservative method instead of adding in more medication, but trying, through some of the techniques and lifestyle changes to see, what you can make. So that diary, that's a great recommendation. Thank you.
Sure.
And the course, so where can listeners find your course, and why do you think it's timely for Parkinson's care in 2026?
Yeah, so the course can be found at lsvtglobal.com. And when you look in the upper right-hand corner, there's a Shop Courses button up there, and you can find it in there with the courses. And Beth, if you have anything else to add about another location, but that was where I found my course once it was listed. So thank you so much. Additionally, in 2026, what I was also thinking about was it is kind of timely. The WPC, World Parkinson's Congress, is in Arizona, in Phoenix, in May. And I really feel like they do a great job at just thinking about the whole picture, right? Not just looking at one part of Parkinson's, but really looking at the whole picture, all of the care and complementary therapies and different ways to conservatively manage Parkinson's, especially with exercise, and with really pulling in that PT, OT, and speech role into the care of someone with Parkinson's, and really having a partner in your care. And so I like to think about myself in that role too. I have my LSVT big practice. When it comes to light that there are these issues with pelvic health, it's a really great connection for me to then see those individuals for pelvic health as well. And we have this connection that we develop for a long-term relationship for their rehab. And I also run an exercise class for LSVT Big with my colleague LSVT Loud. We do a little combo graduate class. So I have this kind of this lifelong establishment of relationship that I have with my patients to care for them in many aspects of their care in their rehabilitation. So I really feel like the WPC really has that framework as well, that they really do think about the big picture and are real advocates for the therapy role in the care of someone with Parkinson's. So that conservative role, like we've said a few times, not using medications, but can we do this without medications? We know that not everything's possible without medication, but the fact that we can give it a shot first and do some of these conservative things is super helpful.
Yeah, I love that holistic approach to care that it sounds like you're doing so well and continuing over time. So that's great. Well, and I want to make sure you get the last word. So is there anything else that you want to add related to pelvic health and Parkinson's?
Sure. So one other thing that I did think about was, how does a person find someone like me, right?
Yeah.
How do they get this type of care, right? So one thing I do want the listeners to be aware of is that you as a therapist, you don't have to be certified in a pelvic health like specialty area. The training is very important, but the certifications are intense, and not every pelvic health clinician has credentials or certification in these areas. So the challenge is the easiest way actually to find a pelvic health clinician is to go to the websites where they do have people that are certified that are listed. So the American Physical Therapy Association, so the APTA, they have a certification called the WCS. So that's all related to a women's health specialty. It's a very rigorous process to be a WCS, and they have those specialists listed there. So those individuals specifically have gone above and beyond to get another board certification for pelvic health. They may or may not know a lot about Parkinson's. That's the other challenge is the individual looking for care may need to just ask those questions if that's something that's important to them. Then additionally, the other place to find a certified provider would be on the Herman and Wallace Rehabilitation Institute website. They have the certified list as well, the PRPC. So PRPC, that's a pelvic rehabilitation certified clinician, that then those individuals are also listed there. So they can find someone that way as well. The other option potentially is your movement disorder specialist might know of a therapist that does this and may also have a referral for you. But a lot of urology and gastroenterology clinics, they also have therapists that they refer to. So, and again, like I said, if the person isn't certified, that's totally fine. They don't have to be certified, but those individuals are just a little harder to find because there's not like a list of those individuals. Yeah.
Well, thank you. I took some notes. So when this episode is published, I'm going to put that in the show notes, the links to those sites so that people can look those up. So thank you for sharing that.
Great.
All right. Well, great. I think we can wrap it up unless there was anything else you wanted to add.
I think we're good.
Okay, well, great. Well, thank you so much for joining us. So I'll just go through some credits to make sure that we give some credit where it's due. So a big thank you to our guest today, Erica Vitek. Thank you so much for joining us and sharing your expertise and wisdom with us. And I wanted to just let listeners know that I'll put a link to your course in the show notes as well. So you can find that underneath the description of the podcast so that you can take a look at that if you're interested. Also, if you're listening, you'll hear the theme song for our episode at the beginning and the end, and that's called Think Loud for Parkinson's by Kindred Spirit and Leo Sayer. And it's a song and video that were inspired by LSVT Loud speech treatment, and it was developed to raise awareness for Parkinson's worldwide. It's available for download and streaming on all major music platforms, and proceeds benefit the UK charity Cure Parkinson's. So I'll also put a link to that video. I want to thank our production team, so CS Design Studios. They help do everything in the background to get our podcasts out there to our audiences. If you're interested in learning more about LSVT Loud, speech therapy, or LSVT Big, physical and occupational therapy, Or if you want to locate therapists in your area, you can visit our website at lsvtglobal.com. And be sure to click subscribe wherever you get your podcast so that you never miss an episode. And we look forward to thinking big and loud with you again next time. So thanks for being here.